Dr. Vineeta Laxmi. This is my second video, and in this video we are going to learn about the skull and overview of the bones of the skull.
Hello again. Let us first start with the introduction of skull. Skeleton of the head is called as skull. Skull is a part of axial skeleton. The term skull also includes the mandible or the lower jaw, which is a separate bone. Like this. Now, for all the descriptive purposes, skull can be studied as a whole. The whole of the skull can be studied from externally in different views. So, what you are seeing is the front of skull. This is front view of the skull. This is termed as norma frontalis. Now, if you see the skull from side like this is called as norma lateralis. If you see the skull from above like this is called as norma verticalis. Now, if you see the skull from behind like this, what is in your view mainly is the occipital bone. So, when you view the skull from behind, this is termed as norma occipitalis. If you see the skull from below, this is called as norma basalis. This is how the skull is studied based on its view from different external surfaces. For study purposes, the bones that are involved in the formation of skull, they are divided into two categories. First, the bones that contribute to form the facial skeleton. These are termed as splanchno-cranium or viscerocranium. And second are the bones that contribute in the formation of cranial vault and the base of skull, right? They together form the neurocranium. Cranial vault is also called as skull cap or calvaria. Okay. Now, if we cut the skull cap in horizontal section and open it up, we can see two things. First is the interior of the calvaria, right? This is external surface of the cranial vault, and this is internal surface of the cranial vault or calvaria, and also the interior of the base of skull. Neurocranium forms the brain case. This is brain case. The interior space of the brain case is called as cranial cavity. This cranial cavity is completely occupied by the brain. The cranial cavity is bounded superiorly by the top of skull, which is called as calvaria or skull cap. The calvaria is formed by the superior part of the frontal bone, occipital bone and parietal bones. Now coming to the base of skull. The floor of brain case is referred to as base of skull. Inside the skull, the base is divided into three large spaces. These are called as cranial fossas. From anterior to posterior side, these are anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Anterior cranial fossa lodges the frontal lobes of the cerebral cortex. Middle cranial fossa lodges the temporal lobes of the brain, and posterior cranial fossa lodges the cerebellum, medulla and pons. Now let us discuss about the ossification of skull. The cranial vault, this portion, ossifies in the membrane, and the base of skull ossifies in the cartilage. So, skull cap or the vault of skull has intramembranous ossification, and base of skull have endochondral ossification. Now coming to the skull bones, they are 22 in number, out of which 21 bones are immovable by sutures and united into a single unit. The 22nd bone is mandible or the lower jaw. It is the only movable bone of the skull and articulates with the temporal bone to form the temporomandibular joint. This I already have discussed in my previous video. Now, out of 22 bones of the skull, 8 bones contribute to form the neurocranium, and out of 8 bones, 2 are paired bones and 4 unpaired bones. Now, which are 2 paired bones? They are 2 paired bones are the parietal bones and temporal bones, one on each side. Okay, the 2 parietal bones have suture in between. This is the sagittal suture, this one is the coronal suture, and this is, you can see from behind that this one is the lambdoid suture. Okay, the sagittal suture is in between 2 parietal bones, and coronal suture is in between 2 parietal and a frontal bone. The lambdoid sutures is in between posteriorly occipital bone and anteriorly parietal bone. Now, which are the 2 paired bones? The first one is the parietal bone. This is the parietal bone on either side of the skull. These are quadrilateral bones, right? And their margins are serrated. These serrations is due to sutures, and they form the vault of the skull. You can see this, the parietal bone on either side forms the vault of the skull. The another paired bone is the temporal bone. Okay, they have squamous part, the mastoid part, the external acoustic meatus, the styloid process, and the zygomatic the process of zygomatic arc, and the petrous part of the temporal bone, and this one is the internal acoustic meatus. Okay, these are the two paired bones that form the neurocranium. Now coming to the four bones that are unpaired bones that form the neurocranium, the part of neurocranium. Those unpaired bones are arranged in the midline. The first unpaired bone is the frontal bone. This is the frontal bone area. You can see, right? This one is the frontal bone. The area before this coronal suture up to here is the frontal bone. The frontal bone forms the part of forehead and the skull, and also the roof of bony orbit on each side. Now the second unpaired bone is the ethmoid bone. This is a pneumatic bone. Pneumatic bone means the bones which does have air-filled spaces, which are termed as labyrinths. The ethmoid bones are very fragile bone that needs to be handled with care. It lodges in the notch of frontal bone. It could not be seen in this articulated skull, but can be easily seen where you could get this individual frontal bone or separated frontal bone. Now next to ethmoid, the third unpaired bone is the sphenoid bone. It lies in the internal surface of the base of skull in the middle cranial fossa. Okay, this you can see, this is the sphenoid bone. These are the sphenoid bone. This is a butterfly shaped bone situated in the base of skull. This is the lesser wing of sphenoid bone. This one is the greater wing of sphenoid bone. This is the body of sphenoid. Okay. On the posterior aspect, you can see this is the medial pterygoid plate. This is lateral pterygoid plate on either side on the posterior aspect of the body of sphenoid. Now the fourth unpaired bone is the occipital bone. This one is the occipital bone. This one. The occipital bone is characterized by a large foramen. This is called as foramen magnum. Now posterior to foramen magnum is the squamous part of the occipital bone. You can see on either side of the foramen magnum, there are two condyles on either side of this foramen magnum. It attaches to the first cervical bone, which are called as, and these are called as the condylar part, and it attaches with the first cervical bone. The basilar part of the occipital bone articulates with the body of sphenoid. Okay, this is the basilar part of the occipital bone that articulates with the body of sphenoid. These are the 8 bones that contribute to form the neurocranium. Now, before we proceed further, let us discuss a bit about pneumatic bones. These are frontal bones and the maxilla. Okay, so these bones have air cells in them. That is why they are called as pneumatic bone. what are the advantages of pneumatic bones having the pneumatic bones in the skull? The first advantage is they reduce the weight of the skull. Okay, the weight of the skull will be reduced by the air-filled bones. Second, they maintain the humidity of the inspired air. They give resonance to the voice. But sometimes the lining membrane of the air-filled cavities also get inflamed, and sometimes the mucus stagnates, leading to infection, and that further results in sinusitis. Okay. Antibiotics and sinus drainage procedures are sometimes the mainstay of the treatment in these cases. Now coming to the bones that forms the facial skeleton. Out of 22 bones, 14 bones will contribute to form the splenocrinium or viscerocranium. Out of 14 bones, 2 bones are unpaired and 6 bones are paired. The 2 unpaired bones are mandible and vomer. As I have already discussed mandible in my previous video, so just for the recapitulation of its part, it is body. This is alveolar border that has sockets for teeth. This one is the ramus. This is coronoid process anteriorly. This is condyloid process posteriorly. This is the angle of mandible. Now, the second unpaired bone is a vomer. This one is the vomer. It forms the part of nasal septum. You can find the vomer from the inferior aspect, just behind the hard palate. There is a midline bony partition which is called as vomer. The posterior portion of the vomer will separate 2 posterior nasal apertures, and the vomer can be defined as a small, thin midline bone that divides the nasal cavity. It articulates inferiorly with the maxilla and the palatines, and superiorly the diverging ala of this vomer articulates with this rostrum of the sphenoid, which is a part of body of the sphenoid. This one is the vomer. This is the diverging ala which articulates with the rostrum of the sphenoid bone, which is the part of body of sphenoid. And anterosuperiorly it articulates with the anterosuperiorly it articulates with the ethmoid bone. This bone forms the posterior-inferior part of nasal septum, which divides the nasal cavity, and that is why it is a bit difficult to find vomer bone from the anterior aspect, but can easily be seen from the posterior surface of the skull. Now let us discuss about the paired bones that forms the splenocrinium. First of all, we will discuss about the maxilla. These are the paired bones that forms the splenocrinium. Okay, it can be identified by the alveolar border with sockets for tooth. These are pneumatic bones, means it has air-filled sinuses, and those air sinuses are called as maxillary air sinuses. They are also the largest air sinuses, and it has a portion that contribute to the hard palate. This one is the hard palate. You can see the alveolar border, the maxilla, and posteriorly it contributes to the hard palate. And in the midline, these two bones are united to each other. One maxilla, this one is the one maxilla and this one is the second, and in the midline they are united to each other. Like here you can see one maxilla and the other one is here, the another maxilla. Okay, so also the maxillary air sinuses open into the lateral wall of the nose. Okay, now coming to the second paired bone is zygomatic bone. This one is the zygomatic bone on each side. What is peculiar about this bone? These bones are very small, but they forms the prominence of the cheek. Okay, and above these bones are connected. This zygomatic bone is connected with the frontal bone. You can see a sutural mark here. This is the part of zygomatic bone and this is the part of frontal bone. So this at this part, this is the zygomatic process is connected superiorly with the frontal bone, and on behind, this one is the behind portion. Here you can see another sutural mark, suture, and this from behind it is connected to the zygomatic process of the temporal bone. This one is temporal and this is the zygomatic process of the temporal bone. Here it is a sutural mark where you can see that they both are united to form the zygomatic arc. Here in the behind it is also connected with the maxilla. This zygomatic process you can see inferiorly is connected with the maxilla, and this zygomatic process also forms the part of the boundary of bony orbit. They are also related to the temporal fossa. Okay, zygomatic process. Now coming to the third paired bone. They are two in number. Okay, this one is the nasal bones. They are two in number, and nasion is the meeting point of two nasal bones. This one is the one nasal bone and you can see this one is the another nasal bone, and this is the point of fusion of these two nasal bones. So let us first discuss about this point. This is nasion. This is called as nasion because it is the meeting point of two nasal bones with the frontal bone. This is the part of frontal bone, right? So nasion is the meeting point of the internasal and frontonasal suture point. This one. These nasal bones are very thin bone, small, and these are triangular, and also found deep to the root of nose. These bones are found deep to the root of the nose. These are very fragile bone. Okay, likely to be fractured on direct blow over the bridge of nose or on the face. These are connected in the midline to each other. You can see the point of fusion here. This is another one bone and this is the another bone, and this is the internasal suture, and this one is the nasion because it is the meeting point of the frontonasal and internasal sutures. Okay, and these nasal bone in the inferior aspect, they form the upper aperture of this piriform nasal aperture, this one, and below this piriform nasal aperture is formed by the maxilla. Now the fourth bone that contributes to the splenectocranium, and they are paired too. They are lacrimal bone. Here you can see the lacrimal bone. Okay, this one is the nasal bone, this is the maxillary process, and this one is the lacrimal bone. So these are the lacrimal bones are paprithin bones, and they contribute to form the medial wall of the bony orbit. That form groove along with the maxilla that lodges the lacrimal sac. Now the fifth paired bone that forms the part of splenectocranium is the Palatine Bone. It can be seen from the inferior surface. This is L-shaped bone. Okay, it has multiple processes. One is the horizontal process and another one is the perpendicular or vertical. One is the horizontal plate and another one is the vertical or perpendicular plate. Now you should focus on this hard palate, and you can clearly see that this one is the posterior 1/5 of the hard palate, which is contributed by the horizontal part of the horizontal plate of the palatine bone. Okay, the perpendicular plate forms the part of lateral wall of the nose. Now coming to the last paired bones that contributes to the splenectocranium is the inferior nasal concha. You can see, just see in this piriform nasal aperture. These inferior nasal concha are the bony shelves that are found in the lateral wall of the nose. In the aperture, you can see a bony partition in the midline, which is called as the nasal septum. On either side, there is lateral wall of the nose. Okay. From the lateral wall of the nose, you can see certain bony shelves. These bony shelves you can see is hanging out. And this inferior most is the inferior nasal concha. Another two are the superior and middle nasal concha. So these are arranged on both sides of the lateral wall of the nose. The three nasal conchas are superior nasal concha, middle nasal concha and inferior nasal concha. The superior and middle nasal concha are the part and parcel of the ethmoid bone, and inferior nasal concha. These are very thin bony shelves on either side, and these two are the separate bones. Okay, it has two surface. The inferior nasal concha has two surface, and lateral surface and the medial surface. The lateral surface has concave surface and the medial surface has convex surface. These inferior nasal concha are very thin, and it includes very thin and lies on the lateral wall of the nose, and it encloses the inferior meatus of the nose, where nasolacrimal duct opens up, and that is part of the lacrimal apparatus. Okay. As a summary, before I finish this video, I would like to just name those paired and unpaired bones. Just enlist the names. Okay. The bones of the splenectocranium, which are 14 in number. The paired bones of the facial skeleton are maxilla, zygomatic, okay, the nasal bones, the lacrimal bones, and the inferior nasal concha and the palatine bones. Okay, these are the paired bones. The unpaired bones of the facial skeleton are mandible and the vomer. Okay. Well, there are certain named points on the skull. Let us take a few of them. If we say vertex, it can be defined as the highest point on the sagittal suture. This one is the sagittal suture, and the highest point on the sagittal suture is the vertex. Now there is one named part that is called as the parietal eminence. It lies on the center of the parietal bone on either side. It corresponds to the maximum diameter of the skull. You can see from one parietal eminence to the another parietal eminence, it is the maximum diameter of the skull. Now the next point is the bregma. It is called as bregma. It is the meeting point of two parietal bones and the frontal bone. This one is the bregma. Bregma is the site of anterior fontanelle, that is unossified membranous gap in the fetal skull. This bregma or anterior fontanelle closes at 18 to 24 months of the age, and it allows the growth of the brain as the baby grows. Okay. Now another named point is lambda. Lambda here. This one is the lambda. This is sagittal suture. This one is the lambdoid suture, and the meeting point is called as the lambda. This is also called the meeting point of two parietal and the occipital bone. Okay, it is the site of posterior fontanelle. That is also the unossified membranous gap in the fetal skull. Another named point on the skull is glabella. This is the Pindi point. Glabella word is derived from the Latin word glabrous, that means smooth and hairless. So this is a smooth elevation in the median part between the superciliary arcs. Okay, this is glabella. Another very important named part on the skull is pterion. This one is the pterion. It is meeting point of the four bones. Anteriorly, this one is the frontal bone. This is the parietal bone. This is temporal bone, the squamous part. Okay, and from inner side, this is the greater wing of sphenoid. Okay, so it is formed by meeting of four bones. This one is the pterion. One more important named point on the skull is asterion. Can you see? This one is the asterion. This one is the occipital bone, and this is the lambdoid suture. This is the temporal bone, and this is the mastoid part of the temporal bone. So this point is formed by the meeting of three bones. This is the occipital bone, this is mastoid part of the temporal bone, and this one is the parietal bone. This one is the parietal bones and this point is formed at the mastoid angle of parietal bone. I hope you enjoyed the video. Thank you.